All right, we're giving it a minute. All right. Hi, everyone. Thank you for joining us today. I'm just gonna give it a few more minutes as people are gonna start rolling in. And we will get started shortly. Just give it a few more minutes as people are coming in from the waiting room. So we're going to get started. So hi, everybody. Welcome for joining today. Thank you for joining today's program, Dialysis 101. I'm Tori. I'm the program manager for NKF Greater New York team. We are so excited to be hosting the program today. And to everyone tuning in, thank you for joining us. So before we get started, just a couple of quick housekeeping items. We'd like to ask anyone who has joined on Zoom to keep yourself on mute. And we also encourage you all to ask questions and we'll answer them all at the end. So if you're on Zoom, feel free to send your questions into the chat. And if you're tuning in from Facebook, please feel free to add the questions into the comments. We'll answer everybody's questions at the end during the Q&A portion of the presentation. So now we'll just jump right in. Again, thank you for being here. Today we're going to learn about many topics related to dialysis, including what to expect during dialysis access, home versus in-center options, a patient perspective, and diet. So I'm going to turn it over to our facilitator of today's program, Dr. Vesh Srivatana. So Dr. Vesh is the director of peritoneal dialysis at the Rogosin Institute. He specializes in the care of PD patients and strives to develop an individualized treatment plan and relationship with each patient and their family. So thank you, Dr. Vesh, and you can take it away.
Thanks, Tori. Again, my name is Vesh Srivatana. I'm a nephrologist. And first, I want to thank the NKF for putting this together. I think it's really important to try to get more education and events out there about dialysis because there's sometimes not too much focus on it, and it's pretty scary. So people want to hear about it. I'm going to introduce our illustrious panel. First is Mr. Jason Dent, beginning a career that spans almost 2 decades in dialysis. Jason started as a hemodialysis technician and progressed into a nursing role specializing in home therapies. Influenced by personal connections with his mother as one of the first home hemodialysis nurses in the Northeast and his father, a dialysis patient, he's currently devoted to breaking barriers and creating solutions to empower patients in managing their own hemodialysis at home. Next is Corinne Balducci. Corinne Balducci, graduate of SUNY Oneonta with a bachelor's in dietetics and master's in public health from New York Medical College. She's currently employed as a renal dietitian at Fresenius Medical Care with both in-center and home experience. Additional work history includes adjunct professor of Westchester Community College and nutrition clinical manager for United States Department of Veteran Affairs. And last but not least is Cecilia Santana. She is a wellness ambassador for the Rogosin Institute, part of New York Presbyterian Weill Cornell Medical Center, where she and her colleagues educate kidney patients on improving their quality of life about the different dialysis modalities in-center peritoneal dialysis or home hemodialysis, as well as the benefits of transplantation and getting transplant listed. As a kidney warrior, Cecilia has strongly advocated for herself as a dialysis patient, both in-center and PD, and especially after receiving her transplant more than 10 years ago. She is engaged with numerous end-stage kidney disease and dialysis patients, participated in lobby days at dialysis centers, and served as a speaker at several events. Cecilia's mission as a wellness ambassador, patient representative, and kidney advocate and peer mentor for organizations and support groups is fueled by her chronic kidney disease journey since 1999 to assist others in obtaining information, resources, and support, which she was not always aware of as a dialysis patient or new transplant recipient. So, by way of introduction, I'm going to talk a little bit about why we're all here. And really, I want to try to address some of the issues and really the fear about dialysis, because that's the number one thing that patients come to me about. And we want to keep things pretty casual. We have a Q&A section later that, again, that Tori said we can put questions into the chat. And we have some pre-planned questions that were submitted previous. So what is dialysis, right? Because this is the number one reason someone's in my office. And it takes a lot of time to explain all the technicalities and options, but I want to boil it down as simple as possible for everyone to understand. Dialysis is a treatment for when your own kidneys do not work. That's the simplest, plainest answer. And a lot of people have a lot of misconceptions about dialysis because they have friends or family and they experienced a certain thing or experienced complications, and they have ideas about what it is and what it isn't. So I want to help clear that up. And the best way I can describe it is imagine a spare tire for your kidneys. Your own car, when you drive and you hit a nail and the tire goes flat, that tire is no good anymore. So you have to go out or call someone and change the tire so that you can keep driving. And that's fundamentally what dialysis is. It helps to do the job of the kidneys when your own kidneys can't, for whatever reason. It's typically from diabetes or something you're born with or something like that. It sort of doesn't matter how you got there. But because your kidneys are not doing their job, we need something to replace it. So dialysis is also known as kidney replacement therapy. That's another word that sometimes is used. What to expect? This is a great question that I want to help answer. And, you know, I do these events and I'm so happy that the NKF is putting out so many more events, because kidney disease and dialysis, they don't get a lot of press. And when there's, you know, cancer or heart disease, there's a lot of patient activism and just awareness about what it is and what it isn't. And yet kidney disease doesn't have any of that. So you don't even know what to expect. You can't. There's no visibility, really. And so the best way I could say this is what to expect is a big change in your life. I'm not going to tell anybody it's fun or easy. That's not what it is. The best thing I could describe it as is something you have to work at. You know, when someone thinks about cancer or heart disease, which are more common, you know, you're looking for a cure for cancer, you're looking for a cure for the heart disease. In kidney disease, it's not exactly like that. The dialysis is like a maintenance therapy that you have to work at. And the patients that have the most success are the most invested in their own care. Of course, I do want to make a mention, there's something called a kidney transplant, which is the ultimate number one goal for pretty much every dialysis patient. That is a true replacement for your kidney. But the focus on this webinar is about the dialysis, because some people are not candidates for transplant, and that's a whole other discussion. But we want to keep the focus on the dialysis portion because many people have to encounter this first, no matter what. Let's see what the next question is something called dialysis access. So this is to discuss how does the treatment actually happen. And so there's two big ways that it's done. One is called hemodialysis, which happens through your blood. In order to get to your blood, we need what's called access, and that's performed by a surgeon or a specialized doctor who can place a catheter or what's called a fistula. And once those accesses are placed, they can be used for the dialysis. The other kind of access is called a peritoneal dialysis catheter, which is a large tube. The best way I could describe it is a giant IV. So most people have had the experience of having an IV. This is a very big version. And that's placed in your belly by a surgeon, and that access is used for the dialysis. I want to pause for a moment just to make sure I'm on time. actually looks good. So I'm supposed to turn it over to Jason to talk about what's called in-center or home dialysis options.
All right, thank you, Vesh. First of all, it's great to be here with you guys. It's a privilege to come here and be a part of this program. First of all, I've been in dialysis for a long time, and I think that it's really important to have early education with regard to what's most suitable for everybody individually. And that's why, one of the most serious things that I really try to embark on is patient advocacy with regard to these options for modalities. So I'll just give a little bit of a brief overview just to discuss, PD versus, in-center and home hemo, to try to give you some answers to questions before they even get there. So the PD options, I'm a big advocate for PD. My father was actually a PD patient. And it's very, very similar to your natural kidneys function. It's key to remember that your kidneys used to work 24 hours, 7 days a week. And the kidneys are actually an amazing organ. They can actually filter half a cup of blood per minute. So when their kidneys stop functioning, there's really two primary functions for the kidneys that they're doing. It's really filtration and also fluid removal and control, in addition to an abundance of other things that maintain balance within the body. Um, so peritoneal dialysis is, like he said, they use a catheter. It's using the peritoneum in the body. And it's more frequent. So that's really the benefit of it. It's really preventing that buildup of these toxins that are normally excreted via, urination. Every day we go to the bathroom, we urinate, and we get rid of these impurities and toxins. And when the kidneys stop functioning, we lose the ability to really get rid of those toxins, and they back up into our bloodstream. So it's important to consider that and take into consideration that that buildup, over the period of time can have effects on the body. You'll start to feel it in your body. You'll start to feel weak. You'll start to feel, generally just like your energy draining from you. So um, peritoneal dialysis gives the option to do more frequent dialysis, and it gives you full control over certain aspects. I'm a huge advocate for peritoneal dialysis just because I feel like, for training process, what you're going to expect is pretty much a 2-week training process, and it keeps you as an engaged member of the team and your care team. And that's really the benefit of home therapies in general. We want somebody who's going to be engaged. You want to feel like you're a part of the practice and a part of your care team. And this gives you full control over that process. It really walks you through, getting rid of these toxins on a nightly basis or through multiple exchanges throughout the day, where dialysate would be drained into your peritoneum, and then you would be able to facilitate the removal of that fluid over a period of time. With regard to in-center, I don't really encourage in-center all the time just because, I'm very partial to home therapies, but I've worked in-center for many, many years. And I always advocate for patients to be engaged with regards to their in-center lifestyle as well. When you go to those in-center facilities, chances are you're going to be there about 3 times a week. Your treatment time can range between 3 hours to about 4.5 hours, usually on average. And you're going to be there with an abundance of other people. It's really just an opportunity for you to take that chance to go in there and defer your care to these people. And I really encourage you to, reach out and learn, advocate for yourself. Always give access to those things. Home therapies, for as regards home hemodialysis in particular, I really suggest to, walk through that road and, lean on your care team, lean on the nurses. Advocacy is a huge part for nurses. It's something that I take very seriously as well. And I always say, like, if you have questions, ask them. The benefit of home hemodialysis is that there's a paradigm that oftentimes you end up with a chair time in your current facility, in your chronic facility, where you're going, and they're going to keep you on an appointment for that 3 times a week, whether it be Monday, Wednesday, Friday, Tuesday, Thursday, Saturday. And oftentimes it really makes you wrap your life around that appointment time, whether it be a first shift 5:30 a.m. treatment start time or a 9:30 treatment start time, or even in the evenings after work. So you can start to build that lifestyle and build that picture of what that would look like. The benefit of home therapies in general is to really switch that paradigm, so that way you're not wrapping your life around dialysis, you're wrapping dialysis around your life. And that's the overall goal for home therapies in general, because it gives you control and engagement over your treatment times. It also gives you an opportunity to liberate your fluids, because like we said, You know, it's part of the dialysis process. Fluid removal is very important. So just keep that in mind. So when you're going to these treatments in these 3 times a week atmospheres, you do get a buildup of those toxins over the course of those 2 days, right? And also you have to monitor your fluids very closely to make sure that you're not going to end up in a fluid overloaded situation. What you'll see in a fluid overload situation is you'll start to see some edema in your ankles, potentially your abdomen, and maybe even your lungs. So, you know, you start to cough a little bit, you'll get some fluid in there, and it probably will lead to discomfort if your fluid gets out of control. Peritoneal dialysis and home hemodialysis give you more opportunities to remove that fluid because it's more frequent dialysis. Home hemo, you're probably going to be doing about 4 treatments a week on average, or 5 treatments a week, depending on which device and which technology you're using. So it's just something to consider moving forward, because you get to liberate yourself a little bit more on your fluid assessment there. You get to have a little bit more fluids. You get to really be there and get to do the things that you want to do as you continue to walk through the dialysis life. Some other things I wanted to talk about were just regarding how do we cope with these things, and how do we stay actively engaged with dialysis and with coping with this chronic illness. You know, the kidneys are a great a very, very proficient organ in the body. The kidneys really just do a lot of work, so it's a big part of what we are in general. And you know, there's diet to consider, and Corinne's going to go into that very shortly as well. But it's multifaceted, like I said. Um, when you turn around and start to cope with these things, that's why I really encourage active engagement and participation in your care team. Ask the questions that matter, advocate for yourself, lean on that care team, like I said, and also just keep into consideration what your expectations are as a patient. For me personally, watching my father walk through those experiences, you know, I wanted him to have a kind of private atmosphere. I wanted him to be able to ask these questions in a forum that made him comfortable. These were the opportunities that I really loved about home therapies, and I found fulfillment when I was a home therapy nurse as well, because we got the opportunity to really close the door. We sat there with the interdisciplinary team, the social worker, the dietitian, and the nephrologist, and we got to really break down and discuss patient concerns, answer any questions that they may have had, and really give them the patient experience that I really desire if I myself am a patient. So it's something to consider when you're making the decision about what is best for you, right? Overall, if I had to do dialysis, it would definitely be at home. It's something that I consider very seriously, and I always ask this question, and I open the question to my team over here if they feel like chiming in. But most of the time, when you ask people, especially in the business, what's the method of dialysis that you would use, and would you do it in center or would you do it at home? 9 times out of 10, my experience is that many people say that they would do home dialysis because it gives you full control, it gives you freedom, and it liberates you from a lot of the constraints that dealing with a chronic illness can often present. Um, with that, I just want to turn this over to the rest of the team here, and I'll return it over to you, Devesh.
Thanks, Jason. The next part is the patient perspective with Cecilia. Take it away. You're on mute.
How's this? So sorry. Thank you, Dr. Vesh. It's wonderful to hear you and Jason and what you had to say. I absolutely agree. And from the patient perspective, I can say that having been a kidney warrior now for 24 years, when I was first told in 1999, my head was spinning on its axis, as is the case for many of us. To Dr. Vesh's point, we're simply not hearing about kidney disease and its effects and how to deal with it. And I feel so fortunate to be a part of something like this, because more and more, I think that people are learning via forums such as this and online, something that really wasn't available when I started out in 1999. I was looked at, they looked at my face, saw some edema, saw that there was some puffiness, and then I was told I needed to see a specialist. That was my intro, and I just was not happy with my primary care doctor because I felt that I should have gotten some more information about what was going on with me. I did not have hypertension. I was not living with diabetes, and I'm not a patient living with lupus, amongst many other reasons why kidney disease exists. There are so many variations, as I've learned throughout the years. Going forward, I just simply didn't know what was going on, didn't know what I was doing, took medicine here and there, and finally was introduced to the Rogosin Institute. And I've been affiliated with them ever since. So in 2004, I was told, yes, you are in end-stage renal disease, and we're going to have to get you started soon enough. And that was the case. I was fortunate enough to learn about peritoneal dialysis, and I did that for several years. Yes, it's a dedication. It took all night, but it gave me the freedom to do what I wanted to do what I needed to do throughout the day. And that's the difference, going back to what Jason was pointing out, in-center versus PD. I will say that as a patient, sometimes we don't always do what we ought to be doing. And because of that, I ended up having to go in-center. I was very distressed. I didn't have anyone speaking to me about, well, we're sorry this is happening. How can we help you? Those types of things have changed. Now your healthcare team, I find, is more involved in paying attention to the patient, to find out where they're at. How are you doing? What is it that you need to know? And it's important for us as patients to really look for that information so that we can be educated, so we can be empowered. That's how we can help ourselves throughout this kidney journey. So I did in-center for about 2 years, and I felt the same way that I did with PD in terms of knowing what I needed to do to help myself feel as best as I could doing this treatment. One of those things that I felt that was most in my power was my diet. So I look very much forward to what Corinne has to say, because I knew that overloading on phosphorus, overloading on potassium was going to affect the information I was going to get back as to how well I was doing. The thing is that we don't know what's going on with us. Again, this isn't a conversation, going back to what Dr. Vesh was saying. It's not a wide enough conversation that people understand what's going on, or for that matter, how important the kidneys are to our bodies. Yes, we know about our lungs, our heart, and our brain, for heaven's sakes, but the kidneys handle so much in our bodies you wouldn't believe. And so that's why it impacts us the way that it does. It's absolutely amazing. We're not alone. There are so many of us out here throughout the country. 37 million people either know or don't know that they have kidney disease. And in New York alone, as I learned through a recent NKF summit, there's like 2.2 million people that adults that are affected by CKD. And of those, over 26,000 don't even know. Because are we being told to look out for this? What is it that we need to do to care for ourselves, to take better care of ourselves? You know, again, it was very difficult. There were ups and downs, but I felt that the best that I could do for myself was to keep abreast as to what can I do for myself. I don't know what's going on with the dialysis machine. I know that it helps me, but what can I do for myself? So little by little, I learned. But again, 2005, 2008, 2011 even, I just wasn't familiar with the resources that are out here. There are resources like NKF, websites that you can go to. We happen, my colleagues and I, the wellness ambassadors, help put together a wellness website to be able to speak from the patient perspective, because we've been there and we know what it's like and what we wish that we had learned when we were going through what we were going through. Some of us didn't know about all of the modalities. We just weren't introduced to these type of things. So I say reach out, speak to people, find out about as many resources as you possibly can. Don't be afraid, because you may only see 30, 40 people in the dialysis unit with you if that is the choice that you make. Again, you know, I felt that going home was the best option for me. Not all of us can go home. Sometimes it's something that we have to work with. But if you have that opportunity and you learn more about going home and the benefits of it, you'll be surprised that you can do this. You don't have to be a nurse to learn how to do this. I did it for 7 years. And if I could have gone on for the next couple of years doing it, I would have. My personal experience is going to be different from every other person. I was dealing with another illness, and so I had to stay on a little longer. But I was able to work, play, do what I wanted. Of course, within limits as a dialysis patient, but the most important thing was I felt well. And no matter what dialysis you choose, it's about wellness. It's about what you can do to keep yourself in the best place possible. You have your healthcare team, you're to depend on them, but you have to consider yourself as part of that healthcare team as well, and realize that speaking up and asking questions is your right as a patient, just as you should do with any of your other doctors. We tend to think that everyone else from the healthcare professionals are the ones that know more than us. Yes, but they don't know if you don't share that information and educate yourself and empower yourself. That's what's going to help you feel better about your chronic illness and moving forward and having the best semblance of a normal life. Because kidney dialysis means life. It means life, and that's something that we need to remind one another. Glad that we're here, that we have this treatment that can help us to live the best life possible and empower ourselves so that we can move forward and hey, even go to transplant, which I've now had for a little more than 10 years. I'm still a patient. I still do the best that I possibly can to be mindful of taking my medications every morning, every evening, and just keeping up with a diet that I know that's going to help me maintain my kidney as best as possible. So I don't want to take any more time. I'll pass it on to Corinne, I guess.
Great.
Thank you.
Thank you. That was very inspiring. Thank you for sharing your story. So I'm Corinne, I'm the dietitian, and it's very interesting. I think, Cecilia, you made an excellent point. When you're feeling so out of control and all these new onsets are coming and adjusting, and it is an adjustment to dialysis, you need something to hold on to, something to perhaps feel in control of. And I feel like that is where the diet comes in. So empowering the patients to be an active participant in their care is key. And one way they can do that for sure is the diet. So in my experience with teaching my patients how to incorporate their diet into their lifestyle is not so much looking at what can't I have and what can I have. It's more of what is going to be right for me and how can I incorporate this diet into my lifestyle. And it sounds cliche, but in moderation. So often I'll get a patient come in and they'll be like, okay, so tell me everything that I can't have. I want the I can't list. And I'm like, no, I'm not giving that to you. We're going to start with what can you have? Tell me about what you enjoy to eat and how can we incorporate that into your diet and into your lifestyle. So as an overview, or basically some kind of key points, we do know that we want to make sure that we're having a low sodium diet. I mean, everybody really should be following low sodium diet. It's good for blood pressure. But when it comes to dialysis, the reason why we focus quite a bit on low sodium is because we know that sodium is going to increase thirst, and many patients will need to be on fluid restrictions. Home dialysis is a little different. You have a little more leeway with the fluids and a little bit more easy to manage, but we still encouraging low sodium diet. So we look at food labels. We'll teach on food labels and how to make your diet tasty, savory, and using, kidney-friendly spices and herbs, because the diet is not bland at all. And I think that's a big misconception. There's ways to cook. There's lots of cookbooks, and your dietitian will guide you on those techniques to prepare your meals and incorporate savory dishes into your meal plan. So sodium is definitely one area we'll focus on. And Dr. Vesh was mentioning about how the kidney really isn't able to do the proper filtering. And two minerals, what we also focus on, and maybe you have or have not heard of these minerals, is potassium and phosphorus. One of the roles of the kidney is to filter that. So when we're eating our foods, we do get potassium and phosphorus. These are minerals found in foods. And what's interesting and what I feel like empowers the patient is that every month we do lab work and you get to see where your numbers are. Perhaps I can't see what you ate, but I have an idea of if the level is high, potassium or phosphorus, we can kind of drill down a little bit and try to figure out what perhaps you may have eaten in your meal plan that can have raised those levels and what we can do to kind of moderate that. So the minerals, potassium and phosphorus, are important to keep in control. You'll see it in your lab work. And what's nice is that patients can work toward, if their levels are a little bit high, work toward improving those goals and those lab values. And they'll see it. They'll see it in their report. So I do focus in on potassium and phosphorus. With home, we often find, because home patients do dialysis more frequently, that they have a little more liberalization when it comes to potassium. So those foods that typically we would say avoid, we may be able to have a little bit more of, or we can incorporate it back into the diet. And potassium we find mostly in produce, like fruits and vegetables. Doesn't mean you can't have them. It just means we have to select the ones that have a lower amount of perhaps the potassium. So again, it's not that they can't have fruits and vegetables. It's just that which ones are going to be right for you. And when I say for you, for the patient, because you're the patient sitting next to you, or maybe that's treating in your clinic, their kidney function may be a little bit different than yours. So their diet might be tailored to them, and it's not a one size fits all. And often patients will overhear somebody saying something and saying, oh, I didn't know I could have that. And I'll say, if you have questions, speak to your healthcare team, speak to your dietitian, because it is not a one size fits all when it comes to the diet. It's very individualized. So we look at sodium, we look at potassium, we look at phosphorus as one of our other minerals that we focus in on, because again, kidney's not able to filter it out so well. And your dietitian will go over a little bit more about phosphorus, but we do look at certain foods, particularly dairy and processed meats. They tend to have quite a bit of phosphorus. The more processed something is, the more phosphorus is going to be in there, because they use phosphorus as a preservative for the foods. So we'll teach about food label reading, how to identify phosphorus in foods. Sometimes your nephrologist will prescribe a medication to help control phosphorus and ensure that you're taking it when you're eating to keep the phosphorus level down. So that is another area that we'll focus in on. And I always tell patients, doesn't matter if you're on dialysis for a year, 5 years, 10 years, you can always ask questions. Over time, things evolve, diets change, people's eating habits change, and we want to make it comfortable for patients to ask us questions. No question is silly. No question is, out of character. Like, why are they asking that? Never. It's never judgmental. It's always like, come bring me questions. I'm here to help you. You're your driving force that we can try to teach, as well as you tell us what your preferences are and how we can try to incorporate that in the diet. So I always encourage patients to ask questions. And then, of course, we'll look at fluid management. As I was mentioning before, some patients do have to restrict the type of fluids or the amount of fluids they're consuming in a day. Anything that melts is a liquid. sometimes patients will be like, okay, so how much water can I drink? And I'm like, oh, it's not just water, it's anything that melts at room temperature. Some patients still have kidney function, so they are making urine and they may have more flexibility with their fluid restriction. And some we have to tighten up a bit because some patients may not be making much urine at all. And therefore, we're going to be monitoring their fluids a little more closely. When it comes to home, as I mentioned before, they may have some more flexibility with fluid. In-center may be a little more tricky. How do we know if they're gaining too much fluids? Well, we're weighing them when they come into treatment and when they leave, and that kind of determines how much fluid that needs to be removed during their treatment. So it is a good way. We tend to measure in kilos, but of course you'll learn real quick on how to convert that to pounds, so you can kind of have an idea of if you're drinking too much and what you may need to do to cut back on those fluids. There are plenty of cookbooks. There's, as Cecilia was saying, there's plenty of websites that give patients the opportunity to educate themselves on resources for diet. There can be plant-based diets. Plant-based diets can be incorporated into the kidney diet. It's not just a restriction of all types of foods. We can incorporate different dishes into the diet as well. The one thing I do want to say too with when it comes to dialysis is that not only are you getting filtered out toxins during your treatment, but protein also tends to be lost during your treatments. So the diet is going to be high in protein, whether you're on home dialysis or in-center. We do encourage a high protein diet. Some patients may have difficulty reaching their protein needs, and we may also encourage a nutrition supplement that's kidney friendly and that would provide them with the extra protein that their bodies are going to need. So I do want to say that I love working with the patients because I feel like we have a great narrative. We put the patient as patient center, so how they are a part of the team. I make sure the patients know that they're a part of the team, and when they come to us with questions, we can try to give them some guidance and empowering them on their care. So hopefully there will be some questions in the chat that we can address too, if need be. Thank you.
Thanks, Corinne. So where we reached the Q&A portion, Tori, do we have questions from the chat also? I just want to have an idea on time.
I can actually go through those ones first, and then I
You
will
wanna
read
do
off
those
the rest of the
first?
questions. Yep.
Okay, and then we'll go through the pre-submitted. So however you like, go ahead, please.
So our first question is from Nancy on Facebook. She actually asked a great question. It comes up a lot. Isn't it scary to be on home dialysis?
You want to take it, Jason?
Yeah,
Anyone?
absolutely. I was going to dive in there. One of the illustrations that I often tell my patients is that, it's a responsibility, obviously, but I also compare it to a car. If a car is misused, it can be a very dangerous tool, right? But you learn how to use it, you get your license, and then you can drive it and it gets you where you need to go. And it becomes an asset and a cornerstone in your life. Dialysis machines are very similar. If they're misused, yes, they can be very risky, and you can definitely leverage modern technologies to make it safer, of course, which is something that I'm very passionate about as well. But the whole point is that you go through this educational process to really get it from point A to point B. So that way you're using it properly, you're confident when you use it, and that confidence is going to build retention, and it's going to benefit you in the long run because you're going to be more of an active and engaged participant, and you're going to own your care. That education that nurse gives you, in addition to the support, we always do monthly educations as well. We review data with our patients to make sure that they're using the machine properly, that they're receiving the support that they would need. And also the benefit of being in home therapies in general is that you always have access to a nurse. That's one of the really huge things that I love about it, because my phone would ring at 9 o'clock at night and my patient would just want to ask me some questions. And I would pick up that phone and I'll sit there with them, and I have no problem just breaking it down because I know that I'm building their knowledge base, I'm making them empowered, and I'm keeping them in control of their care. And that's something that is really a benefit of home therapies and working with the home dialysis machine. And while I understand that, you feel like it can be very intimidating to take that hurdle on, with proper education and proper guidance, it's definitely something that's very doable.
I would add that as
You
a
want to
patient,
comment, Cecile? Oh, yeah.
yeah, I was just going to add that as a PD patient, I felt very confident. But that confidence came about because of my healthcare team. The training that I received. I wasn't going to move forward or go home with my machine until they were absolutely certain that I knew what I was doing. There was no way. And so after a couple of weeks of learning how to do it and knowing that I had the confidence enough that, hey, this is what I need to do. If I did have that question, and again, we're talking several years ago, so things were a little different. We weren't as connected, but nevertheless, I had a number to contact if something was going on with me or my machine. And knowing that that exists, and now we're at a point where you have connections even, via Wi-Fi, et cetera. It's just take it as it goes and you'll be fine.
And I have to say too, I've worked in center and home, and I have seen patients that move from in center to home, and they say, I don't know why I didn't do this sooner. And we had a patient that was probably 69 when she really pushed to get home. And we're like, oh, we're not sure. She has flourished in the home program, just turned 70, and she's doing amazing. So I think it's an education process, like Jason was mentioning, that once you educate yourself and learn more about it, you become more comfortable with the idea. But it is very rewarding to see these patients kind of graduate from in-center to home.
I just want to make a quick last comment about it. We have to make crystal clear that you are heavily trained. It's not like we send you boxes and pamphlets and YouTube videos. That's not how it is. The nurses will train you soup to nuts, step by step. And it's almost like a class in a weird way, or a course of study. And I don't want that to intimidate anyone either, because it's designed for lay people. We have in our program patients with one hand, patients with one eye, and it's a question of the patient. If the person wants to learn and is committed, we'll find a way to get it done. And the idea is, of course, it's a little scary to be so in charge of your own care, but I find it the most rewarding for the patients.
Can I just tie it up by saying a saying in Spanish, si se puede? Yes, it's possible. So I think that when you go with that mindset of this is something that is going to benefit you because of the training that you're receiving and knowing that you want to move forward and learn about this, yes, it is very possible.
One of my favorite things that many patients often tell me, and I used to hear it all the time in the chronic facilities when I used to work with patients, was I know my body. And like they may be like, I'm different. And the truth is you are different and you do know your body. And that's why we really help you to apply what we know in conjunction with what you know about yourself, and get to interpret that and respond accordingly. So I've had patients, that they get dizzy at the different blood pressure than most people get dizzy at, right? So we adjust and we move accordingly. The goal is to get you empowered to own your own treatments, right? And to own your own health in that regard. So just keep that in mind as you embark on this journey, because you really want to have that understanding of, your body and your choice, right? And working with the team to really build that education so that you can treat yourself the way you deserve to be treated.
All right. Thank you so much. That was very helpful. The next one we have in the chat is from Megan. Can you describe a time where you had a patient who was really struggling or a patient that was successful? What strategies or tips can you share?
So I've had patients that really, they try to go home and they really want it. And things don't always go the way we planned them to go, right? The whole thing that we want is real transparency and clarity, and a good relationship with our patients. That's why I always kept communication open. My phone was always on. I really try to go through the guidance and let them know what I'm looking for as a nurse, right? Because I want to look out for my license, but most of all, I want to look out for my patients. I want to do what's best for them. I want to meet the patients where they are. And that's really the most important thing, and the benefits that I think that we oftentimes reap from guiding our patients into home therapies is that, as we go through this together, we are going through it together. I support my patients to really do what they need to do for the best, for their best interest, and I want them to know what I'm taking into consideration and what I'm looking for, so that they can stay in accordance and with the guidance that's presented.
I'll field this question a little bit as well. I think being a dialysis patient might be the hardest thing to be and do on this earth. There's a chance that that's correct. And the reason is because it's, the unknown aspect is one, but it's just really hard. And so when you ask if, is there a time when someone's struggling? Everyone's struggling with something all the time. Maybe struggling is not the right word, but you're dealing with it. And for tips for success is taking one step, one thing at a time. You'll never be able to knock down all the problems all at once. It's just one thing at a time, whether it's, diet or eating less this or drinking a little more or less something else, or taking the medicines or doing the treatments or showing up for the treatments. It's my tip for success is just to keep going, keep at it. And I'll end with one more vignette. I had a patient who had cancer, blood cancer, and she was also on dialysis. The reason she ended up on dialysis is because of chemo from the blood cancer. And so I asked her once, I was like, you've actually had both cancer and dialysis. Which is worse? And she stopped and she thought about it for like 30 seconds. That means it's not an easy decision. It's not an easy thing to judge. And so she said to me, she's like, they're bad in different ways. They're hard in different ways. But the thing about the dialysis is that you keep working at it, and it's work. That's probably the best description. The more you work at it, the better you do. That's my personal belief.
Thank you. The next one we have asks, fluid intake seems to be the most difficult. Corinne, do you have any tips or tricks?
Yes, for fluids, and I think the big part of thirst and not being able to really manage fluid is sodium. Sodium, as we know it, even if you're not using the salt shaker, a lot of foods naturally have sodium. And then, as I was mentioning, the more processed something is, the more amount of sodium is going to be in there. So I think first part is definitely just reevaluating the diet. Maybe first stop with the salt shaker and start cooking a little more with herbs and spices. But you also want to think of other reasons or causes of why your fluids are, harder to manage. And part of it could be from dry mouth. So we'll talk about perhaps some ways to alleviate dry mouth with certain rinses that are available at the over the counter that help to alleviate dry mouth lozenges. We talk about taking mouthwash and putting it in the refrigerator, and then when you're feeling very dry, you can rinse and spit and try to get moisten the mouth that way. Using lemon to help stimulate saliva. So there are several tips that will work, but it's really finding out what is driving you. Is it out of a habit? Are you used to walking around with the water bottle because in the past you were told drink a lot of water, flush your kidney out, and perhaps now things have changed. So looking at cup sizes, for example, everyone says, "Oh, I only have 4 cups a day." Well, is this your cup? Because it's not a cup. It could be 20 ounces. I actually had a patient that I told him, he was getting very frustrated. I said, "I want you to bring in all the cups and the mugs you use at home. Just bring them in to me." And I came out with a little cart and I took each cup and we measured out how much fluid it held. I labeled it for him and he really learned how much that cup was actually holding. So it simple things like that. So there are different ways and different approaches that, your dietitian or you can just kind of evaluate and see what's actually causing these extra fluids.
Thank you, Corinne. So the next one I have is a few questions about getting a fistula. So how long does surgery take and is hospitalization necessary? How often does it need to be done? Do you need to get it done a second or third time? And how can I keep it clean and dry, and can I shower?
Is this from the pre-submitted questions, Tori? Okay. The surgery is usually an outpatient surgery, meaning it's scheduled. They maybe I'll call it the whole package of the day is probably 6 to 8 hours. I would call it a whole day. The procedure itself is probably an hour. So on the order of surgeries, it's not the biggest surgery. And so usually a hospitalization where you stay many days is not necessary. That would be unusual. The way that a fistula works is the surgeon ties together two blood vessels, and then we have to wait for it to mature and get big enough to be used for the dialysis. Sometimes it does have to be done more than once. The usual situation there is if it's someone's been on dialysis many years, and then that particular original fistula is not working the way it used to. That's probably one of the most common times that it has to be redone. But I've had some patients whose fistulas are going on 2 decades, 25 years, something like that. So it all sort of depends on its case by case.
If I can just add, it is the ideal access because it does allow you the ability to shower. You can shower, you can swim, you can do whatever you need to do with the limitation of don't do any heavy lifting on that access arm. But you know, the thing is that my patients oftentimes they turn around and they look about management of their access, and we do routine education in the clinic about managing your access, making sure you're not sleeping on it at night, so it doesn't kind of experience any loss of flow in the access. But you know, when I talk to patients, it's getting to know your access. A lot of patients use that they say, well, I want to know it like the back of my own hand, right? And the whole thing is that you're living with this access 24 hours a day, 7 days a week. You're taking it with you everywhere you go. This is your access, this is your lifeline, and you get ownership of that. And that's why that education is so important on maintenance. And you know, when you have these accesses, sometimes you might have to go for routine cleanings of the access just to make sure it's doing what it needs to do and make sure that, you know, it's not behaving any way that you wouldn't want it to. But it is the ideal access for dialysis.
Thank you. I think we have time for about one more question. So I think this is a very common one. We'll start with, or we'll end with, which type of dialysis is best?
Well, I'd like Cecilia to answer that. I mean,
Yeah,
you know, take it from a patient
It's
She's
perspective.
up
the
to
only
me,
one who's
isn't
had
it?
actually done it.
Okay, I was ready to go, but I will say that the best dialysis is the best one for the patient. Yes, home was wonderful for me. But again, I'm aware that not everyone is comfortable or can go home. And since I was able to experience at least two types of modalities, I did what I needed to do to keep myself at my very best for each. Yes, I had to modify my diet and have a little better understanding once I had to go in center. And again, the reason that I went in center was, well, I wasn't caring for myself as best I should. And that happens, right? We can do so well and something can just occur, whether it's our fault or
Got to
not.
give yourself a break, Cecilia.
Well, you know, I'm a former workaholic. And I think I was simply overworking and not caring for myself and not depending on my healthcare team to say, hey, there's something awry with my exit site for my peritoneal dialysis access. And, you know, maybe I'm right, maybe I'm wrong, but it's just one of those things. But I will say that for me as an advocate, I feel that it was a benefit because now I knew how, now I learned what everyone else was going through, or at least, you know, I had the experience of being in the center. So, you know, it's the best one that's for you, but I obviously I would encourage someone to look into a home modality and see if it's something that you can do. Why not? If it's going to help you live your best life.
And that's really the point there. You gotta, it's no one size fits all. You really have to choose and manage that decision. Take the information find out the details of each, so that way you can make an educated decision with regard to it. And it's also about readiness mentally. I mean, some people might not be ready to really take ownership of that treatment until they get to a certain point, right? You got to make that decision for yourself, and trying to empower people and trying to educate is really something that the team, nurses in general, and all of these members of the team, and nephrologists included, all take very seriously, because they sit there with you and they try to walk you through the pathway. They tell you, based on their experience, what's the best route. But at the end of the day, you got to choose what's best for you, and make that decision for yourself. For somebody, it might be PD. For somebody, it might be in-center. Some people just need the time to make that decision for themselves. So there's now one size fits all.
One more just quick thing for me is it's also what's going on for you right now. Most of my patients, they'll experience all the modalities, transplant, and just in their lives, if your kidney disease actually began pretty young, you probably will be on PD for a while, home hemo, in-center, transplant. So it's to say that at any given time, we want you to have the whole menu options so that you can decide. But I think I like to frame it as what's good for you right now as well.
Great. So we'll wrap it up there. So thank you everyone for joining us tonight, and thank you to our panelists for making tonight possible. We appreciate your support and commitment to the National Kidney Foundation. Be sure to check out our website for upcoming programs, and if you need resources or have questions that weren't asked or answered tonight, my email is in the chat, so you can reach out to me. We'll get your questions answered. I'll send you some resources if you need. And yeah, thank you so much and have a great night.
Thank you.